Hi everybody, Dr. Nikita Vizniak here with the amazing super therapist,
Beth Gear.
And the amazing patient,
Catherine Chung.
So today we're going to show you a sample of a treatment that you might go through, a TMJ issue that's going to involve a brief history, some quick assessment, and then a sample treatment that you might want to consider using in your own practice. And hopefully you find this very useful. So without further ado, we're going to go ahead and pass this off to our amazing super therapist and patient.
Thanks. All right, so because we're working on TMJ, I'm going to ask you a couple questions.
Yeah.
So have you gotten any headaches or anything with any tension?
Yeah, a lot of tension from the jaw and also the back of the neck, and
Okay.
I get headaches probably about a couple of times a week.
A couple times, okay.
Yeah.
Do you find that it's, what pattern is the headache and where do you feel it?
It's mostly in the temples. It's usually worse on the right side,
Okay,
but generally
right.
just feels like just a lot of pressure
In the front
in
there.
the front here
Okay.
as well.
Okay, and you said a couple times a week with that. Do you tend to clench your jaw?
I do subconsciously though.
Yeah.
Yeah.
When you're working, do you find that you're clenching your jaw? Do you notice that at all?
I do. It's either clenching or I tend to just deviate my jaw to
Okay.
the left side.
Okay.
Yeah.
Do you ever lean on your chin or anything like that?
That I do not.
Yeah, no?
Yeah.
Do you lay in your bed and watch on your phone with your cheeks on your
Sometimes,
hand?
but not often.
No, not
Yeah.
too bad. Okay, good. Have you gotten any treatment for it in the past?
I had some chiropractic treatments, but that's pretty much it.
Yeah, no RMT treatment yet?
Not yet,
Okay.
no.
Okay, awesome.
It'll be a fun time today.
Absolutely. All right, so what I'm going to do is I'm just going to get you to do some range of motion with your jaw for me,
Yeah.
just to see how it's opening and closing. This is kind of going to give me the idea of if it deviates to the one side or if it tends to be restricted in any way. You mentioned it gets restricted in certain positions or it gets stuck or locked.
Yeah, it does get locked if I open my jaw too wide, but I find that even if I'm taking a bigger bite of food, per se, it'll start clicking a lot on the right side.
So you're probably limited to eating like big apples and just going for the full bite?
Pretty much,
Okay.
yeah.
We'll try and hopefully loosen that up for you today, and then maybe you can try and eat an apple later today and see how that goes.
Probably not.
All right, so I'll get you just to open your jaw for me nice and slowly so I can watch what's going on here. Yeah, so you tend to kind of go off to this side and you do have quite a bit of a click. I'm just going to feel the side of your cheeks while you're doing that, if that's okay. All right, so go ahead. Is there any pain with that at all?
No.
No? Okay, and then I'm going to get you to bring your jaw open and go side to side and deviate for me. Any discomfort with that at all?
No, it just feels a little pulling on
On
the
that
right side. Yeah.
Okay. So we're going to do a little bit of a quick assessment here. So I'm going to get her to open and close her jaw in a couple minutes here, and then we're going to go side to side just to see how her jaw is opening and moving around. If there's any clicking or locking, I'm going to have my hands on the side of your jaw as well. So first I'll get you to open and close real nice and slow for me. Good. So if you guys watch, you'll see there's a little bit of a click at the end, and then there was a little bit of a movement in the jaw. So one more time. So it goes off to the side. There you go. Any pain or discomfort with that? No? Okay. So opening your mouth just slightly and then deviating side to side for me. Any pain or discomfort with that?
No.
No, I'm just going to put my hands on the side and get you to do that one more time for me. Okay, and then open and close one more time. Okay. And all okay with that? Okay. So what we'll start with is we'll just do a little bit of neck treatment at the beginning just to loosen things up underneath the jaw. I like to work into SCM, digastric, into those areas. I also like to just kind of warm up the area, get the patient relaxed before I start working right into the jaw. Are you okay with that? All right, so this does require skin-to-skin contact. Do I have your consent for that?
You do.
Okay. So let me know if there's any discomfort at any point in this treatment, and I will back off right away. So I'm just starting with a little bit of a fascial shear here. So I'm holding the back of her neck and then I'm just shearing at that platysma, SCM kind of area, scalenes. Should feel like a light stretch. Are we okay with that pressure here?
I am.
Yeah, okay. So while I'm doing this, I am slightly rotating the neck at the same time, just giving that shear a little bit more. So I'll do that on both sides. Are we okay with that side too? Yeah, okay. So So I would spend a little bit longer there waiting for those releases, more relaxed state there, but just to kind of go through a faster process just to see and show you what's going on. I'm going to go right into SEM here, kind of feeling around, palpating. And I'm doing a little bit of a shear here as well. So I'm going to just locate the head and shear downwards. So I find that SEM has such a huge connection into our jaw. Often when I'm doing an SEM release, patients are like, I can feel it right into my jaw. It's pulling the whole thing down. So I think there's lots of restrictions to be set in this area. Do you feel anything into your jaw here?
Not on this side.
Not on this side? Okay. The right side's your crumpy side? Mm-hmm. So just a light shear here. Anything into the jaw yet?
Yeah, right there. Yeah.
We should get some cool like relaxation music going on here.
So
you're really into the vibe.
You can dub that in later though, like that's nothing to put that in, so yeah.
I feel like I should be talking the whole time.
You can. I feel like they would have like the little pop-up words on everything.
That's true, yeah. It's like board exams all over again. Do I talk through the whole thing or do you want me to be silent? I talked the entire time in my board exams. It made me feel more comfortable. I'm going to do this to you now. Are you okay with that?
I find on board exams, if you talk through, then if they miss something that you're doing, at least they can they can hear it.
That's
right?
true, yeah.
Yeah.
So I'm going to pick up your SEM just through the sheet here. Are you okay with that? Okay, so I'm just going to slightly bend your neck into it, starting with like the more unaffected side, just so that you get an understanding of what it's going to feel like. If you feel any referral or discomfort with this, let me know. So what I'm doing is I'm just picking up the SEM through the sheet here. Her neck is rotated towards the position that the side that I am working on. And again, I'm kind of rotating it out, her head out and away, while giving that downward force to the SEM and kind of bowing it. So just really lightly, trying to just loosen it up. So I would hold this for a little bit longer. Giving it a little bit of a wiggle, see how things are moving. The sheet just basically gives a little bit more of a grip for me. My hands tend to slide off every time I try and pick it up. So when I treat my own SEM at home, I'll use a sock. And people are like, why do you have a sock on your hand? Yeah, this side's a little bit more restricted. It's a little bit harder to pick up on this side. So I'm just gonna bow into it here. If you feel uncomfortable, let me know. You feel it just wanting to like slide out?
Nope, not yet.
Yeah, it's resisting my grip.
It's a little bit more tender, but I can take it.
There we go, that's a good spot. And are you feeling that right into the jaw? Yeah. So this time I'm just bowing it down towards the back of her head a little bit, giving it some movement, seeing where it doesn't want to go, kind of holding it in those locations, just kind of getting movement again to that SEM. For me, I could hold this all day on myself. It would feel so good. Did you ever have braces?
Did I have braces? No.
No. Any dental issues in the past?
Nothing major.
No.
A few cavities here and there.
Sweet dude.
So So I'm kind of just needing a little bit of SCM, or not SCM, suboccipital area here, or splenius. SCM is a lot, or suboccipitals are a lot deeper. That suboccipital release, you gotta get like 2 inches in.
It feels so good.
I know. When we did somatic explorations and I saw how deep the suboccipitals were, I'm like, oh, there's no way I'm directly affecting those. So I'm just going to do a little bit of distraction here. You doing okay?
Yep.
So then I like to actually just bring my hands, my fingers up around the ear and coming up in front towards our TMJ joint. I find that patients really like it when you touch behind their ears. I don't think that area ever gets touched. So just acknowledging that, working on that tissue also helps relax them so that they're not clenching when you're treating them. So here I'm going to be wrapping my hand or my finger just kind of around the TMJ joint, just kind of feeling what's going on. So this is going to be more of a lateral pterygoid treatment here. Something of recent that I'm sure lots of people know about that I didn't know about is that it makes sense. Lateral pterygoid is the only one that opens the jaw, so there's usually so much imbalance and dysfunction with that muscle in comparison to the other 3 because they're all used for closing. So when you have a 3-to-1 ratio of something opening to closing, there's definitely bound to be like a strength imbalance and dysfunction. So lots of strengthening for this muscle is what I give a lot of my patients with TMJ dysfunction. And that's simply just leaning on your fist with your jaw and just opening your jaw and resisting that. How are we doing with this pressure here?
It's good, thank you.
Beth, how much more time do you want?
Sorry, I didn't think I'd go this long, but
No,
I'll be quick. I'll
no. You can take up to another 10 minutes.
Okay.
What I'd like to do is come in at the very end and actually just show some joint mobilizations and some adjusting, Catherine, if you're good with that. Mm-hmm. Yeah, so you're getting the full meal deal today.
You are.
Yeah.
Okay, so I'm going to come down into masseter, just under zygomatic process, and just kneading it a little bit here. Oh, I totally skipped something that I want to do, so I'm going to come back to it after. It's like board exams, seriously, being videoed. All right, so when I'm holding this spot, I'm gonna get you just to slightly open your jaw for me. And so I'm just gonna get into lateral pterygoid a little bit deeper. You can stop and close your mouth at any time if you're uncomfortable and let me know and we'll stop. And now I'm gonna get you to close it for me. And then open nice and wide. And if you're comfortable, hang out there for a moment. If you're uncomfortable, just let me know. You're okay. Oh, sorry.
It locked a little, sorry.
If you want to open it just before the lock feeling, that's fine. There you go. Is that okay? Oh, there, okay. If you put your hand up, I'll stop. Now that we gotta build that language up. It's like a dentist. I can't really talk to you and you can't talk back to me with your mouth open. On the 1 to 5 scale, what pressure are we on? You can use your fingers. 3, okay. Okay, you can close. Is it uncomfortable to close with that lock there? That jump?
It's not too bad. It's better than before, to be honest.
Okay.
You can already feel that it's like evened out.
Are you just saying that because we're on camera?
No, I'm being serious.
Okay, so I'm gonna come underneath and then I'm gonna be working on medial pterygoid. So I'm gonna go on one side first. I'm gonna reach right underneath your jaw. Medial pterygoid can be worked on intraorally, but I like to do it externally for the first couple of times. I find it just as effective. But if someone has a lot of issues in this area, you can of course go orally with that. I always tell my patients that, and they're like, ooh, I don't know about that. The 1 to 5, where are we here with the pressure? 2, okay. So I'm gonna bring you back to center. I'm gonna get you to slightly open your jaw for me, and you're gonna deviate side to side. Okay. And if you can do that again, just a little bit slower, a little bit more controlled, good stuff. Awesome, and come back to center. Was that uncomfortable for you?
No, it was intense though.
Okay. And then come back to the other side, rotating and reaching underneath. This side feels a little less restricted. We'll see how it goes when we start moving. So again, opening your mouth and just nice and slowly, nice and controlled side to side deviation. You can stop if you feel uncomfortable at any time. Do you find this side a little bit harder to do?
That's a little easier.
Yeah? Excellent. So then I usually end with temporalis, because then you can end with a really good scalp massage at the end. And seriously, scalp massages are the best.
So take us through some of your quick strokes that you use for the scalp massage and everything, so you got lots of time.
Okay. So typically I'm using mostly my thumbs, just pressing and doing I would say it's more kneading, but kind of a glide through here. Temporalis is huge, so don't forget to get all the areas. I think a lot of people just focus in the temple of like your forehead area, but that's why I like doing the scalp massage at the end too. And then people are forgiving if the TMJ treatment was a little bit sore. All right, so I'm going to pass you on to Dr. Nick, and he's going to do some joint mobilizations with you.
Thank you very much.
Thank you for being an awesome patient.
All right, so it was a fantastic soft tissue treatment done there by a master therapist as we're going through and looking at this. How do you feel after that treatment?
Well, it was even with the shortest amount of treatment, it was actually super relaxing, and my right jaw actually feels a lot more looser, and there's a lot less tension on this side, which is amazing.
Really?
Yeah.
Oh, that makes me so good.
Yeah, so there are a couple of other things that you want to realize here too is, so it's up to the patient to decide. They've had this great soft tissue release done. Now you have to figure out, do I need to mobilize? Is there a hypomobility or a hypermobility that maybe I shouldn't mobilize? Those are some key things that we want to check. So part of your reassessment, if this was in an actual clinic, I would be going through looking at her chart notes saying, hey, how has it changed pre and post? But just for us to see it here really quick, Catherine, if we can, let's just have you open your jaw again for us and just see how it moves. So we can still see a little bit of deviation, but definitely, actually a little bit more there, but definitely better than it was. Okay. All right. But how does it feel for you?
I feel, even though it still deviates a lot and there's that clicking, I feel like there's not as much pulling from the musculature.
Yeah, exactly, right? So you have a couple of options here. Number one, we can go to where that click is. So she'll open up her jaw a little bit, and then we'll see. Okay, so right there is where it deviates a little bit. You can go ahead and fingertips over top, and you can start to mobilize and push the jaw from side to side just a little bit. Now you see most of her head is moving here, but Catherine can feel the pressure that we're putting onto the joint. Now go ahead and move again with that pressure. Yeah, and okay, perfect. Let's give you a little bit more here. So what happened there was this side came loose first before this side. So I'll actually loosen my pressure up here on the side that released first, and I'll go ahead and give her a little bit more, and maybe a little bit more further down. Go again. Opening up. There you go. So you could feel how that was a little bit more even, right? Yeah, a little bit off. I'll go a little bit lighter here. Okay. And then go ahead and open again for us. Nice.
Oh, that's much better.
Yeah, right? So this overpressure right here, what we're actually doing is trying to, and what Beth did really well in her treatment as well, we're trying to teach a new movement and motor pattern here. At the same time, we're giving a little bit of distraction over top of the joint. So your choice could be to cycle through that 2 or 3 times if you wanted, up to 5 or 6, depending on how well the patient's actually doing with it. Then the next thing that I would always do for this, and Beth brought this up again, she was working through splenius, SCM, all these muscles that are attaching to big vertebrae on the back of the neck and on the occipital bone, is just standard adjustments and mobilizations for the cervical spine. So any kind of setup here, and we'll do a demo of a few quick ones. We can use them as a mobilization first where you can just anchor in and then start to push from side to side into directions. This assessment is therapeutic, so for a lot of people, they think that it's you're only doing your assessment, but really you're looking for things that might be off. And I got to tell you, she's moving fantastically after you're a little bit tighter on this side, though. Right, Catherine? You can feel that. So this is telling me she's got a little bit of a restriction here that I can work through. Definitely looser than before the massage therapy treatment was done. Just as a quick example, I can just do a standard index pillar movement like this. There we go. And Catherine, you're okay if we do an adjustment right here? So if it's in your scope, you can do this. If it's not, even just doing these basic mobilizations and a little bit of overpressure, mobilization, overpressure is enough to get you started. But if you want to add more to it, she's going to go right to end range.
Oh, there we go.
Now, I did that lazily. I didn't get up out of my chair, which is what I really would have done, but then I would have body checked our super therapist here. So a little movement like that. And I know what she's saying right now. She's saying, go the other way, please. So, yeah. So we'll get up and go the other way here, too. So other way. I should get off to the side so you can see. Just gently finding yourself in end range. Again, if it's in your scope, this is where you're probably going to stop right here. It's just this mobilization technique well within the grade 4 range. If I want a little bit of overpressure and a quick movement like that. Okay? And then from here, nice distraction. No need to repeat the scalp massage that was done because everything's fantastic. And let's ask our patient, how do you feel, patient?
I feel like a lot of that tension and that pressure that was building up here has gone down a lot. And the fogginess that I was having is a lot more clear mentally. But like physically, there's just way more balance and it's way looser, like Dr. Nick was saying, in the cervical spine, especially in that suboccipital region, which is where a lot of that headache and that tension tends to start anyways. And then I start feeling it up in my jaw. So it all feels much more balanced now, even as I'm talking, which is nice.
Yeah, awesome. So a couple of things to realize on this. Number one, you may need follow-up treatments for this. Patients can usually tell themselves when they start to feel everything getting tighter and up around here. You can feel it in your own jaw, I'm sure, when the headaches are coming on. So all of this is something that you can work around, and that would be an avenue for you to have that follow-up visit. But again, it's on a patient-by-patient basis. So usually these effects will last anywhere from a couple of days to weeks to months for some people, depending on what their activities are. But if you go right back into that same stressful environment, guess what? You're going to see the same return to this kind of system that you're developing here in your body's movement. So just as a sample treatment, hopefully you found that useful. Anything else you want to add, super therapist Beth?
Do some exercises. I want you to strengthen your jaw. So by just chin under your fist and just pushing your jaw open, that's going to strengthen your lateral pterygoid.
Yeah, and she's got her firing pattern down now too. So when she does it, if she sees herself deviate to one side, like this is just coming down, she's going to try and work in a more midline so she knows the direction she's going in. In fact, that was an excellent point right there. Is you are not giving treatment fully unless you are giving home care exercises or some kind of You're missing a big part of your treatment if you're not doing that. So, all right. Okay, well, thank you very much for your time, and hopefully you enjoyed this. Okay.